Okay, hi freestanding ED staff. We are walking through intubation in the era of the novel coronavirus. So there's a few things that are essential for you to know. One is that, of course, we're doing this in the negative pressure room. This is because there's some aerosolizing that goes on. Two, you need more PPE than with your average patient. We'll go through that. Three, you don't bring anything in the room that is not essential because everything will be contaminated. Four, you want to minimize anything that aerosolizes. So bagging the patient in particular, we want to absolutely minimize that. So there's a few strategies we'll talk about for how to do that. And then the last thing, and this is maybe the most crucial, is that you absolutely must familiarize yourself with how to use the ventilator, how to turn it on, how to program it. The physicians will help you with what the settings should be, but pushing the buttons is going to be your job, so please make sure that you know how to do it. And Tara's going to send out some videos and make sure that you guys are all have the information that you need. So you'll need to do a little bit of studying. So first thing is when it looks like someone's starting to become in more respiratory distress, we want to know this early and can control that airway early for a couple of reasons. Number one, we know that these patients go from tenuous to respiratory failure pretty quickly. Number two, we're not using BiPAP because that is a highly aerosolizing situation and puts all of us at risk. So it's not an option. So we're not going to be temporizing people on BiPAP. And number three, we need some time to prep in order to make ourselves as safe as possible and to have the things that we need available in the room. So we need, if you think your patient is going south, please let the physician know sooner rather than later. And you guys all kind of know what this looks like, so just speak up. So prepping for intubation is really important in these folks. One of the first things we're going to do is we're going to try to pre-oxygenate that patient. That's really true of any intubation. It's especially important now because we want to minimize the bagging. So at least 5 minutes on a non-rebreather, preferably with a yellow mask over top of it to limit the spray that's going on in the room. Okay, so get that patient on a non-rebreather so we can pre-oxygenate them and we don't have to bag them as much because they don't drop their sats as rapidly. You guys need to talk with the physician about what RSI meds we're using, have them drawn up and placed in the room in advance. We also need to talk about our sedation strategy for after the fact and have that ready to go, or have a buddy getting that ready to go while you're doing the intubation. So we want to be able to kind of make all that move smoothly because you're going to be in full PPE, thoroughly contaminated after this intubation, and so it's better to kind of have all that worked out in advance. So we're going to pre-oxygenate, we're going to get our RSI meds ready and in the room. We're going to get the things that we need. Okay, so there's a few things that you're going to grab. Number one, you're going to grab the glide scope. Okay, so the glide scope has all this great stuff in the basket. Take it out because once it goes in the room, it has to be trashed. So take all the stuff out of the basket. In fact, maybe we want to go ahead and do some of that. Mm-hmm. The other thing you're going to grab is this red COVID intubation box. It has, and I'm going to open this and show you what's in it. It has PPE for this process and some other kind of essential pieces of equipment. Do not take this bin in the room, please. So take all the stuff out of the bin and take it in the room. So I'm going to just break the tape seal here and then we'll put it all back afterwards. So here's what's in this box. So we have these impermeable surgical gowns. So the nurse and the physician should be wearing these blue gowns. Put it on, do the ties like you're supposed to, okay? Take the time to do that. Also in here, there is the rest of your PPE. There are N95 masks, there's the disposable stethoscope, there are some surgical gloves. And one of the things that's important here is you are going to double glove in this situation. Okay, double gloves are important because you are going to heavily contaminate yourself during this process, and you want to remove that first layer of gloves once you get that tube secured before you start touching the vent and touching the other things in the room. So surgical gloves in the bottom because they're really closely adherent to your hand, and then regular gloves over top of those so that you can easily remove them. So there's I'm noticing there's yellow gowns in here. I think these are meant to go underneath the impermeable surgical gowns to give you another layer of protection when you take off that surgical gown. There's also, also in here are hair covers, so please put that on your head. Okay, so also you'll find in this kit, this is the GlideScope goodie bag. We are missing a stylet from this bin, I'm noticing. So it has the GlideScope covers. You'll also need the GlideScope grab bag. So let's just pause for a second and
Ready.
So this is your GlideScope grab bag. I just grabbed it from behind the desk here where we're keeping these. It has your GlideScope cover. It has the stylet. It has the tube securing device. It has some lube, and it has a syringe in here as well as a selection of endotracheal tubes. So this is all the stuff you need to put a tube in the patient. Okay, so you grab this, leave this kit outside the room. The other thing, there's two other things in this kit that are important. This is a blue HEPA filter. Okay, this should filter out virus particles. This attaches between the ambu bag and the ET tube, and then between the vent circuit and the ET tube. Okay, so this is protective. So take it out, look at it, and feel it before you intubate the patient so you know which way it needs to go on the bag, because it's not obvious to me right now. This is a biohazard cover. Part of the procedure is you want to wipe down the GlideScope after it's used with the purple wipes. Am I correct in that? Yeah, with the purple wipes, and then you cover it with the biohazard bag. Okay, so that's what's in this bin. Okay, and so the bin stays outside the room, the stuff goes in the room. All right, so once you're in the room, in the negative pressure room, we're pre-oxygenating the patient, we have our meds there, we know what we're doing with our ventilator, okay, so we need to turn that on, make sure it's working, make sure you get things set to where you want them to be before the tube goes in the patient, okay, you've got that on standby. You've got extra people and extra stuff out of the room. You're gonna close the door. Okay, so this is ideally a 2-person procedure because we want to absolutely minimize the number of people who are exposed to the aerosolization that's going on in that process. So we'll kind of walk through just a little bit more here in room 7. So if you'll join me over here. Okay, so now we're in the room and we're still preparing. I'm wearing my blue gown, I have my N95, my face shield, my cap, I have my double gloves on, which I actually have on right now. One thing that you may not know is what size surgical gloves you wear. I'm a 6.5, Dr. Baylor is a 7.5. So come slap us a air high five and kind of measure up your hands. But I think a lot of women are probably about a 6.5 is a good place to start. If your Baylor size is 7.5, 8 would be really large hands. So we're in the room. So you're getting your RSI meds ready. You're setting up the ventilator, getting that ready to go. The physician should be setting up their tube. So we're going to be doing all these intubations with the GlideScope because it increases the distance between the patient's face and my face. So we're going to plug it in, we're going to turn it on, we're going to load it. We're not going to have any of this stuff on the cart, right? Because we don't want extra stuff in the room. We're going to load up the blade on top of the GlideScope. We're going to get our tube. We're going to put the stylet in. Okay, the stylet is the rigid thing that goes in the middle. We're going to attach our syringe, test our balloon, lube up our tube. Other things we're going to have ready to go are that blue HEPA filter right between the bag for the bag or between the tube and the vent, and then our tube holder. And if you're not familiar with how to use these, take a look at it. Go find yourself a video online, okay, to be sure you know how to secure the tube. We don't want to be figuring these things out in the moment. All right, so we're ready to go. What we're going to do is we're going to ask for the medications. We're going to keep that non-rebreather on the patient while we're asking for the medication. So I'm going to be up here, up at the head of the bed, and I'm going to say, okay, we're ready for the etomidate. You're going to go ahead and push the etomidate. We're going to wait a beat or two, and then we're going to go ahead and push our paralytic, probably either rocuronium or succinylcholine. There's some folks who are advocating for using more rocuronium because you get a longer duration of paralysis, which is safer for us. So you're going to go ahead and push your meds. We're going to try really hard not to bag that patient, more than a breath or two. We've got this handy intubating box that Virginia Burke's dad made for us, which is amazing. This is going to go over the head of the patient. We'll have a few more of these made up by Friday. And you'll have one that lives here at the freestanding ED. One thing that we found when we were trialing this is that since you're intubating right-handed, you just slide this over just a little bit so it's not totally centered on the bed, and then we're able to do all the manipulations we need to with the patient. So we're going to bring the bed up to the height that's appropriate. We're going to go ahead and intubate this patient. We'll use the glide scope. We're going to get our position. We're going to pass our tube, and then you're going to be ready to pop that stylet out, okay, and inflate the cuff. So what we're going to do is we say, I'm past the cords, pull the stylet. So the stylet is this really rigid, super curvy, hard thing that's inside, right? So I'm going to grasp that tube with all my might, and you're going to pull, you're going to brace the tube and pry that stylet out, okay? It takes a little bit of force, and you're going to be prying it out so it's going out this way under the box. It does work. We've tried this out. It should fit, but you can't go straight up. So you need to work with the doc to get that stylet out. The next thing you do is you're going to inflate the syringe, and that's going to inflate the cuff of this endotracheal tube, and then we're safe from this patient's secretions, right? Unless they're coming out of this end of the tube, we've just created a seal. So we're going to inflate the cuff on the tube. We're going to have that HEPA filter right here. We'll attach the bag to the HEPA filter, and we'll bag that patient while you get that vent ready to pop on the tube, okay? So we'll be bagging. Sorry, the other thing that needs to happen first is we need to secure that tube. So we'll use the tube securing device. Okay, at this point, it's probably safe to go ahead and remove this shield if it's in your way. If it's not, just go ahead and leave it there. We're gonna slip this under, secure the tube, okay? Doc's bagging. All right, and then you're gonna go ahead and get that ventilator hooked up to that HEPA filter here. All right, and we're going to use the disposable stethoscope to listen to the lungs and confirm breath sounds. So some of this is going to be a little bit more old school than we're used to doing with the end-tidal CO2 and so on and so forth. We're trying to minimize our contact with that patient, so we're going to be doing more listening and more sort of analog methods of determining that the tube's in the right place. So after that's done, after I'm done intubating, I'm going to take off this top layer of gloves. Okay, because these are super, super soiled. So we're going to discard those in our bin here. Ideally, before you touch the ventilator, you will have removed your top layer of gloves as well. So after you help secure that tube and inflate that balloon, take off your first layer of gloves so you still have a layer underneath, and then push the buttons. Okay, so less contamination of the ventilator is just safer for all of us. So we've got our patient intubated. They're on the ventilator. You will have discussed all the settings beforehand, and then hopefully we've got a more stable patient who is ventilating well, and then we'll get them off to where they need to be. I'm going to check my list here and see if there's anything that I forgot. Oh, yep, there is. Okay, so what do you do afterwards? Okay, so you're still in your PPE. Okay, so you're going to probably be in this room managing this patient for quite some time. So you're going to stay in your full PPE with your N95 mask. The physician's probably going to leave the room. So when I do that, I'm down to my one pair of gloves. It's over my surgical gown. I have my face shield and I have my N95. So the gown and the gloves, I'm going to take off by the door in the same way that you know to doff your PPE. I'm going to perform hand hygiene beforehand on my gloves, right? I'm going to take it off. I'm going to hand hygiene myself again. Then I'm going to leave the room and take off the rest of my PPE. If there's someone who can kind of coach you through your PPE removal, that's best case scenario because you are going to be contaminated after this. And I'm going to take my N95 and I'm going to deposit it in the N95 bin that's out front. What else are we missing? Cleaning the glide scope. So anything that's in the room is totally contaminated and is going to need to be Virexed or wiped down or whatever our protocols are at this point. The glide scope inclusive, which is why we don't want any of this stuff in the basket when it comes in the room. Everything gets wiped down with a purple wipe and it gets covered with the biohazard bag. And that I think covers it.